Okay, this is part 4 of Hidden History of Nutrition and Health, and we're going to talk today about Dennis Burkitt. Dennis Burkitt is an Irish doctor. He did his surgical training in England, worked there for a little while, and then he became a Christian missionary to Africa. And the guy was, he's an underrated genius. This guy, he first of all saw a child with a jaw tumor, and then he realized there seemed to be an unusual inheritance pattern with it. And he traveled all over Africa, going to all the hospitals. He drove over like 10,000 miles in a car, visiting all these hospitals and mapping out the incidence of Burkitt's lymphoma. Like this child right here has a Burkitt's lymphoma. And there was a strong interest in that in the world at the time, trying to understand the causes of cancer. And people were so impressed with his work, he was made the head of epidemiology in hospitals for much of Africa, for many hospitals. I forget the exact number, like 1,000 hospitals. Okay, and then he started to get data from people all over the world and different theories of disease, different patterns of disease, and that's when he figured out abdominal pressure syndrome. And he did all kinds of research. By the way, this is a really good biography of him. This biography right here by Ethel Nelson, physician, about Burkitt. It's an excellent biography. Okay, so he traveled all over Africa, and he did all kinds of strange things for his research. They seem strange to us now. He would he'd collect people's feces and measure it and weigh them. And he was trying to figure out what was going on. So this is his abdominal pressure syndrome. So the gist of it is that when you eat a high fiber diet, and he thinks humans are designed to eat at least a minimum of 50 grams of fiber a day, but routinely they used to eat 100 grams of fiber per day. So basically, fiber, the key thing it does is it adds water to the stool. It pulls water into the stool. So it makes the stool more soft and bulky. So when you defecate, it's like a cow patty rather than being like a bunch of goat pellets. And the relevance is the stool will accumulate down here in the rectum, and it'll stretch the walls of the rectum. You have a voluntary and involuntary rectal sphincter. So the voluntary rectal sphincter says, hey, let's wait till I get home. I don't want to, do a number 2 here. The involuntary sphincter, so when you get to the place where it's safe, let's say you're home, you just get a reflex contraction of the rectal muscles and you defecate effortlessly. And that's how a defecation should be. That's normal defecation. What happens to a lot of modern Westerners eating a standard American diet, there's no fiber in meat and there's very little in processed food. They end up with a bunch of goat pellets, Howard Tootsie Rolls for their stool, and they have to contract their abdominal muscles. That's called a Valsalva maneuver, to contract one's abdominal muscles to aid in defecation. The relevance is that pushes back pressure into the abdomen. That back pressure pushed into the abdomen has many negative consequences. It pushes the stomach up into the chest gradually. It keeps pushing against the chest, and it widens the esophageal hiatus. So this is called a hiatal hernia. And when part of the stomach pops into the chest, by the way, I see this a bunch of times every day, it causes loosening of the lower esophageal sphincter. And so that's called GERD, gastroesophageal reflux disease. And that'll cause inflammation in the distal esophagus and at the GE junction. And because of this, gastroesophageal junction, distal esophageal cancers have become much more common. And they're very often typically like an adenocarcinoma. In the old days of smokers and drinkers, back when I was a young trainee in medicine, we mostly saw squamous cell carcinoma. Okay, so anyways, hiatal hernia, gastroesophageal reflux, and gastroesophageal cancer. Much more common. All right, the next thing is the back pressure goes into the rectal veins, so you get rectal hemorrhoids. The back pressure is also transmitted, against the blood returning from the leg, so it causes varicose veins. The constant pressure sort of probes the weak spots in the abdominal wall. You get more periumbilical hernias, more downward hernias, more inguinal hernias. Okay? The back pressure pushes into the sigmoid colon, which is connected to the rectum, and it causes outpouching of the wall. These outpouchings are called diverticuli, or a diverticulum is an individual one. If they pop, then they leak stool into the mesenteric fat, causing it to inflame. So that's called diverticulitis. It's very common. In any Western hospital, they get at least one, often several admissions every week from diverticulitis. Okay, the other thing is because the stool is dry on the right side of the abdomen, you will form little little rocks of stool. Lith means stone. So to form a little stone in the appendix out of stool, you can also call it a fecalith, a feces stone. It'll obstruct the appendix here. The mucus glands distal to that continue to secrete their mucus, and then they can't get back into the rest of the colon. This is the cecum. Here is the terminal ileum entering through the ileocecal valve into the right side of the colon. This would just be called right-sided colon or ascending colon as the stool goes up in that direction. All right, so anyways, the appendix at its ostium connection with the cecum is occluded by this appendicolith. The mucus glands distally keep secreting their mucus. This appendix swells, that becomes very painful, and then it'll pop. That's appendicitis. Okay, so all of these things are manifestations of abdominal pressure syndrome, and Dennis Burkitt figured this all out in the 1960s. And just to give you an idea, this is 1,000 times, 1,000,000 times more important than Burkitt's lymphoma, but this is never in any of the textbooks. I also happen to know multiple general surgeons. I did a surgical internship. I never heard of Burkitt's abdominal pressure syndrome. And I can also tell you, I know guys who are good abdominal surgeons. They don't know anything about Burkitt's abdominal pressure syndrome. It's ridiculous. This should be like the fundamental, most basic thing in their field. They don't know it. I am not kidding you. These are guys that operate on the abdomen every day. They probably have maybe 3 OR days a week, but they don't know abdominal pressure syndrome. And you can learn it. I just taught it to you in 10 minutes. Also, I have friends that are the creme de la creme, if you will, internal medicine, the king of the AOAs, like guys with encyclopedic memories. They memorize the books backwards and forwards. They don't know abdominal pressure syndrome. They don't know Dennis Burkitt because he's not in their book. All they know is they vaguely associated him with Burkitt's lymphoma, something that was a test question in med school. So I'm just telling you, that's pathetic. This is basic. These are all common problems. Rectal hemorrhoids, varicose veins. Also, it goes down into the scrotum, the scrotal veins, and causes them to dilate. That's called a varicocele. That heats up the testicles, and that can cause infertility. So these are basic common things. The same patients will have other manifestations of what I came up with the name, the Western abdomen. Things like gallstones, they'll have coronary artery calcifications, they'll have ischemic degeneration of the spine. So anyways, Dennis Burkitt, major magnificent discovery that nobody knows about. And that's why this book is called The Hidden History of Nutrition and Medicine. Here's some, standard Dennis Burkitt quotes. And the guy was a genius. He's just very modest, so he doesn't brag and show off. That was his style. Mine's a little different, as you might have noticed. Okay, Dennis Burkitt quotes, "The only way we are going to improve our health is to go back to the diet of our ancestors. A plant-based diet. Our ancestors ate about 100 grams of fiber every day. If you eat a lot of plant foods, you will eat a lot of fiber. If you eat a lot of fiber, you will have bigger bowel movements. When people have big bowel movements, they only need small hospitals. When they have small bowel movements, they end up needing large hospitals. It is better to build a fence at the top of a cliff than to just park ambulances at the foot of the cliff, which is what modern healthcare system does. If the sink is overflowing, it's better to shut off the tap than to keep on mopping the floor." And then he says, "A healthy diet of plant foods will prevent disease. Diseases can be prevented. It is much more difficult to treat a disease than to prevent it." By the way, there's a really good video, I think it's the only one on the whole internet, of Dr. Dennis Burkitt being interviewed by Dr. McDougall. So you go to Dr. McDougall's YouTube channels, like Dr. McDougall Health Center, and you just type Burkitt's name into the search, you'll see the interview of him. It's very good. Okay, so that is the scoop on Dennis Burkitt, the Irish Christian missionary who made these magnificent discoveries. I hope you found that helpful.